Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Angina. What is angina? Owing to deficient supply of blood in heart muscles, there appear sudden pains, pressure feeling, heaviness, burning sensation behind sternum bone of chest. This situation is called angina or Angina Pectoris. Pain may radiate towards hand, shoulder, neck, jaws, back. Generally, angina is not fatal, but one must remember this is often seen as the precursor of coronary heart disease. What are other symptoms of angina? Number 1, vertigo. Number 2, nausea. Number 3, severe tiredness. Number 4, breathing troubles. Number 5, cold sweat over face and chest. What are symptoms of angina in females? Number 1, shortness of breath. Number 2, vomiting or nausea. Number 3, pain in abdomen. Number 4, stabbing pain instead of chest pressure. Number 5, discomforts in neck, jaw, back. Actually, compared to males, two special symptoms comes here. One is pain in abdomen. This symptom is not in the males, and stabbing pain. This is generally doesn't present in male. Chest pressure is there. So these are the two exceptional symptoms it comes here. What are types of angina? Number 1, stable angina. Most mild type attack comes during hard labor, stays for 4 to 5 days, 5 minutes only. Recoverable easily from rest or medicine. Patients are aware of the pattern of attack. Number 2, unstable angina, fierce type. Attack may occur during rest, stays for longer period. No benefit from rest or medicines. Pattern of attack unexpected, unknown. Precursor of heart attack. Number 3, microvascular angina occurs due to atherosclerosis in fine arterioles of heart. Atherosclerosis is the accumulation of sticky things in the fine artery or arterioles. That is called atherosclerosis. That sticky thing narrows down the lumen as such the blood supply minimized. Worse than stable angina, subjects suffer from sleep problem and considerable breathing comforts. Often stays over 10 minutes, may stay more than 30 minutes also. Here the atherosclerosis have been shown in image stepwise. This is starting, this is gradually accumulation of atheroma rather, sticky things in the lumen. This is almost covering, almost the lumen is covered. Number 4, variant angina, least visible but chronic type. Attack may come in midnight, morning, during complete rest. Spasms in carotid artery is the reason. Often severe cold, mental stress, cocaine, cigarette act as triggers. How to prevent or manage angina? Number 1, stop smoking and other addictions. Number 2, keep body weight under control. Body mass index in case of male should be around 2.5 and in case of female it should be around 21. These are the best body mass index figure for maintaining standard health, standard weight. Number 3, keep cholesterol under control. Number 4, take some physical exercise daily. 5, get sound sleep for 7 hours daily. 6, get enough fresh vegetables, fruits, complete grains, low fat, easily digestible proteins daily. Avoid salted, sugary, fatty foods, packeted or canned foods, and drinks such as much as possible sun, red meat, and trans fat completely. Tabecum for angina. Nocturnal attacks of tightness of chest with palpitations and paroxysmal oppression. Neuralgia up to the neck. Pale face, cold extremities and clammy sweats. Glowing heat in face with redness and frequently on one side. Violent beating of heart and carotids. Sudden precordial anxiety. Violent palpitation lying on the left side passes away when turning to the right side. Note, I have underlined a few symptoms. Note that these symptoms are the keynote symptom for selection of tabecam in case of angina. The keynote symptom are the symptom which segregate the particular remedy from others. So note this symptom which is underlined most mindfully. Spigillia for angina, abnormal action of heart with pains, worse from stretching out, bending forward, lifting arms, or from least motion, better from stooping, touching the stomach externally. Severe stabbing, stitching in the heart at every beat, pains rapidly passing around the body from left to the right inside. Sudden severe pain in the left chest, so violent that it knocks the subject down. Spasmodic pains in stomach, inducing vomiting of contents but not bile, contents of the remnants of foods, etc. Nesa tripudians in short trip for angina, sudden agonizing pain in heart, unusual beating audible to the subjects, heat filling with uneasy aching and oppression in heart, stitching pains in heart, inability to speak with choking, pains not affected by inspiration, nervous chronic palpitations. Loroceratosis for angina, attacks of suffocation with gasping for breath and cyanosis when sitting up, stitches in precordial region. Precordial region is a part of the chest just in contact with the heart. This is, look at this figure, this is the heart, image of heart. This square area in the chest is called precordium, where the heart is in touch with the chest wall. With violent pain in stomach with loss of speech, cold moist skin, convulsions of the muscles of face, nervous cough arising from cardiac affection. Digitalis for angina, sense of oppression in chest with tendency of fainting, chest pains extending to head and left arm, mental anguish with vertigo and fainting. In advanced cases, when the disease sets in suddenly with drawing, tense spasmodic pains in left chest and sternum towards nape of the neck. Nape of the neck, the image of nape of the neck has been shown here. This area is called nape of the neck and upper arm. Diascoria for angina, sudden severe pain in the middle of sternum, action of heart, very feeble, pulse less, pains extending from chest to both arms and hands, cold, clammy sweat all over, subjects unable to move. Cactus grandiflorus for angina, feeling as though an iron hand was around the heart, preventing its motion. This symptom you can call an USP, that is uncommon strange peculiar symptom. Worse lying on the left side when walking and at night with great melancholy. Suffocative constriction in throat with full throbbing carotids. Periodical fits of suffocation with fainting. Cold sweat on face and pulselessness. Asafoetida for angina. Palpitation more like a tremor. Heart seems full and distended, beating of heart and pulse small, quick, irregular. Nervous palpitation from overexertions or suppression of discharges in case of women. Lachesis for angina. Attack during or after sleep. Frequent attacks of fainting, daily with nausea. Difficult breathing, palpitations and cold sweat. Choking, constricting or rising in throat with organic disease of heart. Rising in throat means actually something as if something is coming above the throat. Inability to lie down or to speak. Very distressed feeling after a short nap. Note that I have underlined two particular symptoms. The first one is attack during or after sleep and very distressed feeling after a short nap. And here also organic disease. Actually, these symptoms are the keynote of lachesis for selection of angina. Mind this, lachesis is a drug where patient is always feeling worse during after sleep. So these two lines has been underlined throughout this video. Wherever I have underlined, mind this, those symptoms are the keynote symptoms of the particular disease, particular medicine. And key symptoms are the most important symptom to select in this situation. Hydrochloric acid for angina, irregular feeble beating heart, feeling of suffocation with torturing pains in chest, long-lasting spells, heart diseases with violent palpitations. With this, the video ends. I will request you, please, if you treat somebody with who is supposed to suffering from angina, please ask him to consult a good cardiologist, because very often angina is a precursor of heart attack. If he is a patient of future heart attack, we cannot know this thing because we are not expert in examining heart. Only a cardiologist can do this. So if you ask to consult a cardiologist, maybe that he will be he will be prevented from this particular attack, because cardiologists know how to check it. So please advise him properly. With this, the video ends. Thanks for listening, viewing. If you got anything to say, please write down in the comment section. I will certainly reply.